It was 2:15 in the morning last Tuesday when my phone rang. I recognized the number immediately. It was Amanda, one of my longtime clients, and she was whispering. She said, "Dr. Colin, I'm so sorry to call this late, but something is really wrong with Cooper. He won't lie down. He's been sitting in the corner of my bedroom for 3 hours, just staring at the wall. Every time I try to get him to lay on his bed, he sits right back up. He looks terrified. Am I overreacting?" I was already putting on my shoes. I said, "Amanda, bring him to the emergency clinic right now. I'll meet you there in 15 minutes. The fear in her voice shifted to panic. She said, "Is he dying?" I had to tell her the truth. I don't know yet, but dogs don't forget how to sleep. If Cooper physically cannot lie down, something inside his body is very, very wrong. When Amanda arrived with Cooper, a 7-year-old golden retriever, I could see the problem the second she walked through the door. Front legs slightly splayed, head lowered, breathing shallow and rapid. When she tried to guide him to lie down, Cooper resisted with frantic determination. He'd lower himself to sitting, but the moment his body started tipping toward lying on his side, he shot back upright. It wasn't defiance, it was survival. I put my stethoscope on his chest and heard exactly what I was afraid I'd hear. His lungs sounded like a washing machine, filled with fluid. Cooper was in the early stages of congestive heart failure, and sitting upright was the only position keeping him alive. If Amanda had waited until morning, Cooper would have drowned in his own lung fluid by sunrise. Hi everyone, I'm Dr. Colin, your neighborhood veterinarian, and I need you to understand something that could save your dog's life tonight. Your dog's sleeping position is not just about comfort or preference. It is a direct window into what is happening inside their body. Dogs are masters at hiding pain and illness. It's a survival instinct hardwired into their DNA. Your dog will smile at you, wag their tail, eat their breakfast, and act relatively normal even when something catastrophic is unfolding inside their chest or abdomen. But there is one thing they cannot fake. They cannot fake the position their body needs to be in to survive. In the next few minutes, I'm going to show you the 5 emergency sleeping positions that mean you need to get your dog to a vet immediately. Not tomorrow, not next week, tonight. This is not about being paranoid. This is about learning the language your dog is speaking with their body when their voice cannot form the words, "I need help." Let's start with the position that saved Cooper's life. Cooper had been showing subtle signs for weeks that Amanda didn't recognize. He'd been choosing to sleep on the tile floor instead of his plush bed. She thought he was just hot. He'd been waking up frequently throughout the night. She thought he was getting old. He'd started sleeping with his head elevated on the arm of the couch. She thought it was cute. But here's the medical reality. When a dog's heart begins to fail, it can no longer pump blood efficiently. Fluid backs up into the lungs, a condition called pulmonary edema. When a dog with fluid in their lungs tries to lie flat, gravity causes that fluid to spread across the entire lung surface, making it nearly impossible to get oxygen. It feels like drowning. Sitting upright pulls the fluid down toward the bottom of the lungs, leaving the upper portions clear enough to breathe. We got Cooper on diuretics and heart medications that night. We pulled nearly a liter of fluid out of his lungs over 48 hours. Today, Cooper is managed on medication and sleeping comfortably. But if Amanda had ignored her instinct, Cooper would have become a statistic. Here is what I need you to watch for. If your dog is suddenly preferring to sleep sitting up, keeps standing up shortly after lying down, seems restless and cannot settle, or is breathing faster than normal with pale or bluish gums, you have a cardiac or respiratory emergency. Do not wait. Do not post about it on Facebook asking if you should be worried. Get them to an emergency vet immediately. The second emergency position I need you to know about is one of the most misunderstood positions in veterinary medicine. 3 months ago, a woman named Lisa brought her 5-year-old schnauzer, Milo, into my clinic Monday morning. Milo wasn't interested in playing, didn't want breakfast, and kept doing what Lisa called downward dog yoga. She thought he was stretching. She even took a video because she thought it was cute. When she showed me the video, my blood ran cold. Milo wasn't stretching. He was in the prayer position. Front legs extended forward, chest and head lowered toward the ground, rear end still standing upright. It looks exactly like a play bow or a stretch. But here's the critical difference. A play bow lasts 2 seconds. A stretch lasts 5 seconds. The prayer position lasts minutes, and dogs will move into it, hold it, move out, and go right back into it repeatedly, because it is the only position providing any relief from excruciating abdominal pain. When I palpated Milo's abdomen, he flinched. Blood work confirmed my fear. His pancreatic enzymes were over 15 times the normal limit. Acute pancreatitis. The pancreas produces digestive enzymes. When it becomes inflamed, those enzymes start digesting the pancreas itself and surrounding tissue. It is one of the most painful conditions a dog can experience. The prayer position stretches the abdominal cavity, creating just a little more space, just a little less pressure. It's the dog's desperate attempt to find one single second of relief. Milo was hospitalized for 4 days on IV fluids, pain medications, and anti-nausea drugs. Lisa kept saying, "I thought he was just being goofy. I didn't know he was in pain." And that is exactly the problem. We as humans misinterpret the prayer position as something playful, when in reality it is a scream for help. If your dog is repeatedly moving into a prayer position and holding it, seems reluctant to eat, has vomited even once, or their abdomen feels tense when you gently touch it, you are looking at a potential gastrointestinal emergency. Pancreatitis, bloat, intestinal obstruction, all of these can present this way. Do not wait to see if it gets better. It won't. The third emergency sleeping position is one I wish more people knew about because it is incredibly common in senior dogs and almost always dismissed as normal aging. Last month, I consulted with a man named Greg about his 11-year-old Labrador, Sadie. She had become a terrible sleeper. Lie down for 10 minutes, get up, circle, lie down in a different position, get up again, move to a different spot, over and over all night long. Greg thought maybe she was developing dementia or anxiety. When I examined Sadie, I found the real problem. Her hips and spine were riddled with arthritis. Every position hurt. She'd lie on her right side until the pressure became unbearable, switch to her left side until that hip started screaming, try lying on her chest until that put pressure on her elbows and spine. She was trapped in a body that had no comfortable position left. Here's what people don't understand about chronic pain. It doesn't always look like limping or yelping. In senior dogs, chronic pain often looks like restlessness, irritability, panting at night, and the inability to sleep for more than a few minutes at a time. We put Sadie on a multimodal pain protocol, including a nonsteroidal anti-inflammatory, gabapentin for nerve pain, and a joint supplement with UC2 collagen. Within 1 week, Sadie was sleeping through the night. Greg called me in tears. He said, "I didn't know she was suffering. I thought she was just getting old." Sadie wasn't just getting old. Sadie was in agony, and her body was telling us every single night. We just weren't listening. If your dog is over 7 years old and you've noticed increased restlessness at night, frequent position changes, panting while resting, or reluctance to jump on furniture they used to jump on easily, please talk to your vet about pain management. Do not accept "they're just getting old" as an answer. Age is not a disease. Pain is not a normal part of aging. It is treatable, and your dog deserves relief. The fourth emergency position is one that almost no one recognizes, and it is the position that tells me a dog is suffering from a neurological crisis. 2 weeks ago, I received an emergency call from Vanessa about her 3-year-old Australian Shepherd, Blue. He'd seemed wobbly on his back legs during their afternoon walk. But that evening, when Blue lay down to sleep, something was very wrong. His entire body looked stiff, almost like he was flexing every muscle. Legs extended rigidly, neck arched slightly backward, eyes closed like he was sleeping, but his whole body felt rock hard to the touch. When Vanessa brought Blue in, I performed a neurological exam. His reflexes were hyperactive. He failed conscious proprioception testing on both back legs. Emergency imaging revealed a severely herniated disc compressing his spinal cord. Blue's rigid sleeping position was his body trying to stabilize his spine to prevent further nerve damage. The muscle rigidity wasn't relaxation, it was a protective neurological response. Blue had emergency surgery that night. If we had waited even 12 more hours, Blue would have lost the ability to walk. Vanessa told me she almost didn't bring him in. She thought maybe he'd pulled a muscle. But something in her gut told her it wasn't right. That instinct saved Blue's ability to walk. If your dog is sleeping in a position that looks tense or unnatural, with limbs rigidly extended instead of relaxed, neck arched backward, body feeling hard to the touch, or if you notice any weakness or wobbliness during the day, you could be looking at a neurological emergency. Spinal injuries, toxin exposure, seizure disorders, and brain inflammation can all cause this. Time is tissue. The faster you act, the better the outcome. The fifth and final emergency sleeping position is the one that breaks my heart the most, because it is the one that dog owners almost always ignore until it's too late. Last Thursday, I euthanized a 9-year-old boxer named Tank. His owner Jim brought him in because Tank had stopped eating and had been vomiting for 2 days. But when I took Tank's history, Jim mentioned something that made my stomach drop. "The weirdest thing, Doc, for the past week, Tank's been sleeping with his head pressed against the wall. I thought maybe he just liked the cool surface." Tank's gums were pale yellow, jaundiced. His abdomen was distended with fluid. The ultrasound revealed late-stage liver cancer that had metastasized throughout his abdomen, causing hepatic encephalopathy. Toxins that the failing liver couldn't filter were accumulating in the bloodstream and crossing into the brain. Head pressing is not a dog resting their head on a pillow or leaning against you for comfort. Head pressing is when a dog compulsively pushes the top of their head against a wall, a corner, or a solid surface and holds it there. It looks strange and unnatural because it is. It is a clinical sign of brain dysfunction caused by liver disease, kidney failure, brain tumors, toxin ingestion, infectious brain disease, or head trauma. It is never normal. Never just a quirky preference. Jim was gutted. He said, "I saw him doing it for a week. I took pictures because I thought it was funny. Why didn't I know?" I told him the same thing I'm telling you. You can't know what you were never taught. The veterinary community has failed pet owners by not educating them about these warning signs. We wait for you to bring your dog in when they collapse, when they stop eating, when they're actively dying. We don't teach you how to see the emergency coming days or even weeks before it becomes critical. But I'm teaching you now. 3 weeks after losing Tank, Jim called me. His buddy's dog had started head pressing. Because Jim recognized it immediately, they got the dog to the vet that same day. Early kidney disease. Treatable. That dog is alive because Tank's story was told. If you ever, and I mean ever, see your dog pressing their head against a wall or solid surface and holding it there, get them to a vet within hours. Not tomorrow morning, within hours. Head pressing is a medical emergency, period. Now let me give you peace of mind by telling you what normal looks like. A healthy, comfortable dog sleeps in a variety of relaxed positions. The side sleeper with legs extended means they feel safe. The curled-up ball is natural for warmth and security. The belly-up position means they feel completely safe and are regulating body temperature. The Superman, belly down with legs stretched front and back, is normal for a half-asleep dog ready to play. These positions look effortless. The dog breathes calmly and shifts naturally throughout the night without distress. Emergency positions look forced and uncomfortable. The dog seems unable to get comfortable no matter what they try. And critically, emergency positions are almost always accompanied by other subtle signs. Changes in appetite, energy, drinking, urinating, vomiting, coughing, panting, pale gums, or behavior changes. Your dog's body is always talking. The sleeping position is just one sentence in a much larger conversation. Here's the action plan I want you to commit to right now. First, take a picture of your dog sleeping tonight in their normal, relaxed position. Save it labeled baseline normal. If their sleeping position ever changes dramatically, you'll have a reference point for your vet. Second, learn your dog's normal resting respiratory rate. Count breaths in 60 seconds while they're sleeping calmly. A normal dog takes 15 to 30 breaths per minute at rest. Write the number down. If it suddenly jumps to 40 or 50, something is wrong. Third, commit to a weekly body check. Run your hands over their entire body while they're relaxed. Feel for new lumps, areas of heat, areas of tension. Check their gums for healthy pink color. This takes 3 minutes and could catch cancer or infection before it becomes advanced. And fourth, trust your gut. You know your dog better than anyone on this planet. I cannot count how many times a client has started an appointment with, "I'm sorry, I'm probably overreacting." And then we find something serious. Your instinct is your dog's best defense. Honor it. Cooper is doing well, on heart medication, sleeping peacefully, and Amanda checks his respiratory rate every evening like clockwork. Milo is thriving on a low-fat diet without another flare-up. Sadie is pain-free and sleeping like a puppy again. Blue made a full recovery and is running agility courses. These dogs are alive because their owners paid attention. They are alive because someone noticed that the way they were sleeping wasn't right. Tank didn't make it. But even in his loss, there is meaning, because Jim has now told every single person he knows about head pressing, and 3 weeks ago, that knowledge saved another dog's life. That's why I make these videos, not to scare you, but to arm you with knowledge that could mean the difference between catching something early and losing your best friend too soon. If this video taught you something that could save your dog's life, please like and share it so it reaches more people. Subscribe so you never miss information your vet might not tell you. And leave a comment below telling me what position your dog sleeps in most often. Now go check on your dog, watch them breathe, make sure they're comfortable, and make a promise that you will always pay attention, always listen to what their body is trying to tell you, and never ignore your instinct that something is wrong. Thank you for loving your dog enough to educate yourself. I'll see you in the next video.